Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our Hospital System General Director. Today is Tuesday, December 1st, giving you the update from Albany Med. Now, Fred, we've been doing these since March.
Yes.
We've done well over 100 videos.
9 months.
And we always start with COVID.
That's right.
But today we're not going to start with COVID. We'll get to COVID in a bit. But as has been widely reported, there's a strike occurring here on the campus today. We're not going to get into the specifics of what brought this on. For the video today, let's focus a little bit more on how we're handling this on this campus. And this is really, I would say, a remarkable and good news story. Fred, talk a little bit about the nurses that we employ, Albany Med nurses, and how they've responded to this.
So Dennis, we as well as other members of management have been talking to the nurses about coming and caring for patients today. You know, fulfilling our mission, their mission in terms of caring for patients. And a lot of them listened to us.
They did.
You know, they're really dedicated people. 408 nurses came to work today.
That's incredible.
That represents
76%.
76% of the shifts today.
76% of all the shifts today are filled with nurses from Albany Med. We talk a lot about mission, we talk about not abandoning our patients, and in point of fact today, we saw that absolutely. For that many nurses to come forward, despite what I would say would be some pressures not to do so, they rose up, they were brave, they were courageous, and they were taking care of patients here in a way that makes me so proud.
3 to 1, they came to work with only one not coming to work.
That's right, and that includes both in the hospital setting, inpatient, outpatient, and the practice. And that's just the day shift.
That's right.
So we know that when the evening comes and the night comes, there'll be more nurses who have already said, I too am not going to abandon my patients, I'll be there.
Right,
so we'll have another number to report in a couple days, for sure.
You know, they reacted to the mission, they made the decision with their hearts.
For sure. And we've talked about that. And Fred, we did a press conference today. It was about an hour long. We were joined by Fran Alpert as well as Dr. Louis Filhauer, our Chief Nursing Officer. And that entire video will be available for the workforce to watch. That'll be on our YouTube channel. And there'll be a couple different ways to get it where we go into greater detail about the mechanics of this.
Right. You know, Dennis, I have to say I'm really proud of the nurses that came into work today.
I am too. I am too. And I'm also incredibly proud of all the entire Albany Med family because it took an entire group of people volunteering to come in early in the morning to make sure that we provided a safe way for our nurses to get into the hospital and our patients.
And you know, Dennis, all the other staff, you know, the PCAs, the transporters, the technicians, all of them, I'm proud of them as well.
And we talked about this in the press conference. Care continues. Babies being delivered, surgeries, a lot of very complex surgeries happening today.
Some very serious emergencies that have been performed,
Transfers coming to the hospital, cancer being treated, etc.
So I said at the press conference, almost 2,000 patients received some form of outpatient treatment here by noon today, which is kind of a typical day for us. Big number.
Now, Fred, you know, we were hopeful that our nurses would react in such a brave way, but just to be on the, the safe side, we also had to get professional nurses to come in, to be here to care for patients, and that also occurred as well.
It did, Dennis. Think about the logistics of getting 650 nurses into our community over Thanksgiving weekend, and getting them trained on our systems and badges and the whole 9 yards. You know, just a tremendous effort by a whole lot of people to make that happen, and they did. They made it happen. And
we will definitely run into difficulty here by calling out any particular member of our workforce who really stepped up, but the Center for Learning and Development really did a remarkable job getting all those people up to speed.
Unbelievable job.
For sure.
Absolutely.
Fred, for the replacement nurses who came on site here, who are working alongside our nurses, were they tested for COVID before they got here?
Every single one of them, Dennis.
Okay.
And there were a small handful that were positive, and they're not working. You know, they, I think it was 6 that were positive. So all the nurses in the building today and tonight, COVID negative.
Outstanding, outstanding. All right, well, we'll have more to say about this. I encourage you to watch the press conference if you'd like to find that, and we'll talk more about this. But congratulations to our incredible nurses here at Albany Med.
Absolutely.
Let's transition over to COVID, and let's pop up the first graph here. So this is the capital region. As you can see, 176 currently in hospital beds being treated for COVID. If you look at that other number, Fred, the lower number, I guess if there's any good news in that first graph, it's that the percentage in the ICU is smaller than it was. But there's no question that the slope of that graph is dramatic.
It's definitely going up, and we're not unusual, unfortunately, across the state. Other regions are seeing the same sort of thing.
Next graph here is admissions and discharges to the medical center. And again, I think the graph visually speaks for itself. One thing that I'd like to point out is below that horizontal line, you have discharges, which are represented in green, and then you have people who have died in black. And unfortunately, in the last 10 days or so, we've had some people pass in the hospital from COVID. It is a good reminder that, as we've said many times, to a vulnerable population, which includes elderly and underlying medical conditions, this is a serious disease.
That's right, Dennis. It really is. We have to take it seriously.
Yeah. And to all the members of our workforce who are treating that population, again, you have our thanks. So the last graph then is the morning census. And Fred, I think it's 63. What's the breakdown there?
63, 11 in intensive care, so that relatively low number, and I think 3 on ventilators.
Okay.
So it continues to go up. We were 59 yesterday, so we've gone up by 4 one day over the other.
So we'll watch those numbers very carefully. Let's talk about 2 more things related to COVID. The first one is another remarkable news story. We've been talking for a while now about major pharmaceutical companies coming forward with data that talk about vaccines. And we've talked about Pfizer, we've talked about Moderna as 2 of them, AstraZeneca being the 3rd. Fred, you and I both read earlier this week about Moderna's data.
Yes.
So I'll tee it up and you can take it from there. So they took 30,000 people. They vaccinated 15,000 with their version of the vaccine, and 15,000 got essentially a placebo.
That's right.
And then they studied them. Who was likely to get COVID, and whether or not they got COVID, did they get very sick? The results of this vaccine trial are nothing short of breathtaking.
So Dennis, 100% of the patients who received the vaccine were protected against serious illness. Another way to say that is none of those 15,000 got seriously ill with COVID.
It's unbelievable. It's unbelievable. So. I think when I read the news story, the CEO of the company said that when he read the results, he cried. He couldn't believe how effective it was. And as I sit here, I can't believe that in December of 2020, we're talking about a vaccine that's potentially that powerful. And there are others out there that are coming as well.
There are, Dennis. This is phenomenal. So all 3 companies that are developing these vaccines in a rapid fashion, it's very, very important. It's going to be very important for our staff.
Yes.
As COVID continues to go up, we've got to be able to protect our staff so they can provide care for our community. So, we need to start thinking about that. The staff out there need to start thinking about that as the vaccine becomes available. We're going to want you to take it.
For sure, and we'll be talking about that. One other thing, Fred, before we get to the last topic. Yesterday, the governor announced some new rule sets that were coming out related to hospitals and COVID. We don't have to get into all the specifics today, but people who watch the news may want to know, are we aware of those new rules, and are we thinking about them?
So we are, Dennis. We've seen a summary. Frequently, the governor will put out a new rule set, and then it'll take a week or so before we see detail around that rule set. But yes, there are some important changes he's going to make. Probably the most important is he wants us to function like a region and load balance across the hospitals, which, you know what, Dennis? We do. We do.
Yeah.
We've got the infrastructure for it.
All right, very good. So we'll talk more about that. And then lastly, Fred, in the past, when there's been mass gatherings in the region, I can think back to a couple this summer, including some informational picketing that occurred here on this campus. We put out a message to our workforce that said, if you participated in such mass gathering, we're advising you to seriously consider being COVID tested, because we know those are circumstances where passing the virus can occur. So to that point, we know there is some picketing occurring outside today on our campus. And so we're saying to the members of that workforce, or anyone really in the community who may be there, you should consider being tested.
Absolutely, Dennis. It's very important. Any kind of exposure or potential exposure, it's something to think about. Get tested.
To the members of our workforce, as you know, we have the ability to do that testing for you. And in no ways would this be anything where we would look to spy on you. We simply are saying, if you want to come in and get tested, we have that ability to do so.
We're thinking about your health and safety.
And that of our patients.
That's true.
Okay, very good. Okay, so today's Tuesday. We'll be back again Thursday. And I think we'll have some more information then.
Yes, absolutely.
All right, very good. Once again, to the members of our workforce who helped be sure that our mission continued today, we thank you.
Thank
we really
you.
do. We do. We ask that you once again, please take care of yourself, take care of each other, and we'll see you on Thursday.